Well, good afternoon and welcome to the Flint Community Webinar on Coronavirus. We are now 112 weeks. Today, in partnership with the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center, bringing to you this very important webinar. As we remind you every week, we wanted to make sure that we were addressing this global pandemic from a local perspective. How do we put a local context to the things that we're experiencing? And we'll talk a little bit more about that today. I'm glad to be your host today, Yvonne Lewis, as one of the co-directors for the Healthy Flint Research Coordinating Center. And it has been my pleasure to be able to moderate these sessions. And of course, all of us wear so many hats in the community. That's why we appreciate all of these partners who have joined us every week for this webinar. Some have been able to be almost every week and some come as they have opportunity, but we want you that are listening today, whether you're listening by Facebook or you're on the phone, or maybe you picked this up by YouTube at some other time, to know that these community partners are available every week to answer questions for you. So for those of you that are with us live today, please remember you can put your questions in the Q&A, put your questions in the Q&A, and we will be responding to those questions. And if you have some ideas that you'd like us to respond to in a future session, please feel free to put those in as well. Just as a reminder for today, I want you to know that the Genesee Health Plan is here with us, Greater Flint Health Coalition, Genesee County Health Department. We'll have the Genesee Community, Genesee Health Systems, as well as Hamilton Community Network, I think I said the Health Department, and of course the City of Flint, Michigan State University, and the University of Michigan, and we have representation from Hurley Medical Center. So if you have questions today, please feel free to put those questions in the Q&A and let us respond to them for you. Today, we're going to focus in on a couple of really important things. One, employment and COVID. We're living in changing times and recognizing that all of us are impacted either from an employer perspective or as an employee. And how do these things affect us in our everyday life? We're going to talk about children's mental health awareness. I think you've heard us over the last few weeks talk about how important mental health is, and for all of us, but particularly we want to focus today on what's happening and what can be done for our children. We're going to talk here an update on race equity data. And of course, the Genesee Health Department and the City of Flint will be here to chat with us as well. So let's get started. We're going to have our panel come and join us today, and included in our panel today will be Clarence Pierce from Hamilton Community Health Network, Jim Melanowski from, thank you for giving me that tip, Jim Melanowski from the Genesee Health Plan. I also want to have Kaylee get prepared to join us, Dr. Susan Wolford prepared to join us. You can back up, Toysha, for me. I do want to recognize these very, very important dates. We did have last week, or on yesterday, Thursday, was Cinco de Mayo. And many of us, and one of the things we do, this is the health, partnering with the Flint Center for Health Equity Solutions. We want to make sure that we raise these very important issues. Cinco de Mayo, for those of you that don't know, is celebrated on the 5th of March as a victory over France in the Battle of Pueblo during the French-American War. So that is a really, really important event for our Latino Hispanic community. We also want to recognize that this is Asian American and Pacific Islander Heritage Month, which is very, very important as well. And so we want to make sure that we're recognizing that throughout our communities, there are specific racial ethnic groups that are impacted by so many things that are happening in our community. So now I do want to go to our panel. Thank you. I want our panel to come forward and let's have a little bit of a chat, and then we're going to talk about another really important issue. Our panel, Jim Melanowski, Dr. Lawrence Reynolds, Clarence Pierce, and Kaylee. We're talking about today this employee-employer situation. If you can tell us, I want to start with Jim and Clarence, talk to us a little bit about your role and what you've had to do in making decisions about how to keep your employees safe from an employer perspective. And Jim, I see you nodding, so I'm going to nod right over to you, and then we'll talk to Clarence.
Yeah, we should have Clarence go first. No, this has been, I think I've said this before, and I say it all the time to my staff. Probably the most challenging thing as an employer has been this COVID. Normally, you want to convey an air of confidence and leadership when, as the leader of your organization, and in most aspects, in the past, you're able to handle something. You have policies and procedures to rely on and follow and enforce. This was certainly a new challenge, and at first I think myself and our director of operations tried to lay as much of a course out about how we were going to handle it as an employer, and tried to get as much input from people in the know. And wow, information kept changing, and variants kept changing, and so it has been over the last 2 years quite a challenge, and we've learned quite a bit. One of the things is that we wanted to make sure our staff was safe. So we did not mandate vaccines at the health plan, but we mandated testing, regular testing, and reported testing back to us, as well as mask wearing with our employees. And even with that, I calculated that about 30% of our staff tested positive, with variations of how sick they got. Fortunately, we had nobody who was hospitalized or, had a lot of adverse reaction other than some severe symptoms that they had to deal with, like on an outpatient type of business, a type of situation. So it really has impacted us. What we ended up doing was setting up phases, so that like phase one for us was a total shutdown like we had in March of 2020. Everybody was home working remotely, to we set it up on a continuum to phase 5, and that's where we would be totally open to the public, and masks would be optional. And we're just not at that point yet. We're in phase 4, and this has been developed through our director of operations and our staff. We have a safety committee, and we set up these guidelines, and that seems to have worked for us. And we've gotten a lot of good input from the people, the staff on a day-to-day basis that deal with the members we serve, and then each other. So
Thanks, Jim, because sometimes that's a challenge when employees can't always see what happens in the background, and they're wondering, is this for our best protection? And
right.
So I see you nodding, Clarence. So what's been your experience in all of this? Clarence, you're on mute. There you go.
Sorry about that. Good morning, everyone. But we were very much like Jim when this virus hit us in March of 2020, and we went into lockdown. I mean, it was like we were blindsided. We quite honestly didn't know what to do at that point. We were unprepared, and so we had to quickly transition over to a telehealth system whereby we could at least provide some health care to our patients by video or telephone. And we didn't know what we were going to do in terms of having patients come into the office. And so we were dealing with fear, not only with our patients, but with our staff. Everyone was very much afraid, didn't know what to do. We had to keep in mind that safety was our first principle, which is to keep the employees safe, keep the patients safe. So we had to implement the personal protective equipment so that the staff would be protected. Uh, we quickly implemented a process by which we would have anyone who had symptoms not come directly into the clinic, but we would actually come out to their cars and make a quick diagnosis of whether or not they had COVID or not. And so in some cases, it meant doing a quick test to see, because, those symptoms were very much like allergies or just possibly flu. And so it was hard to detect. You just didn't know, exactly what to do. And so that was our first step. And in doing that, we had to make sure that the facilities were prepared. And that meant upgrading our ventilation systems
Mhm.
so that we could make sure that the airflow was such that it could continue to carry out any virus that may have come in, because some patients they don't know, they're not educated, and they will come in. And we found in some cases we had people coming in who had symptoms but didn't say they had symptoms,
Ah,
and we found out later that they actually had COVID. And so protecting the staff and the patients were our first priority. And then, of course, we had to do the social distancing, and that meant marking the floors, making sure the chairs were far enough apart that people would be safe and not have to worry about it. And like Jim said, when the federal vaccine mandate came out, of course, uh, some people didn't want to take the vaccine. And of course, we had that problem to deal with. Not only patients, but we had some of our staff who did not want to take the vaccine. And so uh, I'm happy to say that we were able to get at least 90% of our employees to take the vaccine. We had about 14 that requested uh, to have that exemption done, and we were able to exempt most of them. Unfortunately, we did lose three of our employees to the virus in this whole process. One physician, and actually two of our other support employees. So it had a real toll on our staff, and we're still dealing with it in many respects because we have not changed our protocols. I mean, we still require masks when you come into the site. Our staff, they still wear masks. And I think we're trying to be maybe a little bit overly cautious because we can recall last year around this time, we thought it was over
mhm,
and we had another big blowout.
mhm.
And so we don't want to be in that same situation this year. And we're taking every precaution to make sure that we keep our staff and our patients safe.
Yeah.
And so far, I'm happy to say, I think we've been able to do a pretty good job. And I want to thank our staff for all the hard work they've done. And Yvonne, we had to deal with the staff shortages. I know we all had to try to fight through that, and we were down. Normally, we have anywhere from 250 to 260 employees, and we were down to around 200. And most of those were our support staff, our medical assistants, our customer service representatives, and we need those positions. They're vitally important in getting patients through the system, registered, uh, vitals taken, and those things. And so when you lose those patients, it fall on our providers. And I'm happy to say, and I tip my hat to our providers, because in some cases they were rooming patients, and everybody just stepped up and pulled together. And we are so far getting through it pretty well, but we still have a ways to go. We're not out of this yet, and
And I'm
we're
glad you
taking all the precautions.
Yeah, and I'm
Mhm.
glad you say that, Clarence, that we're not out of it yet, because I know, again, we talk about it a lot. It's not in the popular media news as it once was, but COVID is still real. Now, we've seen the two examples, Jim, healthcare, getting people enrolled in healthcare. We still had opportunity to engage with patients, but our staff could primarily work remotely. You're in a position where you can't have staff working
Right.
remotely. You needed them in the clinics. And so I think it's important that we take a minute just to kind of see behind the scenes a little bit. I want to ask Dr. Reynolds, and I'm Dr. Reynolds, because you were serving as a chief public health advisor to the mayor when all of this came. And so even from an employer perspective, or from that vantage point, how can you talk to us a little bit about some of the considerations you had to make for the city employees and as the chief advisor for the city?
I like the title chief, but I thought myself as a health advisor, but
Health advisor.
nonetheless.
I'm sorry, I keep giving you the chief. Yeah.
multiple considerations because we had employees in multiple settings. We take for granted the people at the water plant who must be there 24/7, so they had to be protected. So masking was most important. Those who drive city vehicles, emergency vehicles, first responders. We had to talk about air circulation in a vehicle. We recommended masking and vaccinations when they came out, but you also have to understand you have to open the vents on your car. You can't recirculate the air, and you have to crack your windows so there'll be some air exchange. And those little things we had to pay attention to. And as Mr. Pierce said, there were the big things: ventilation for buildings. And typically for service buildings, non-commercial buildings, they are not the most up to date as far as air exchange and filtration. And then there's the issue of maintenance. So we had to make sure our maintenance records were up to date. And then we did the things that my colleagues, Jim and Clarence, did, made sure that there was spacing, physical distancing, so that people would have space. Now, in the beginning, we didn't know everything, so we used those plastic barriers, and we still use them. However, it's not a substitute for all those other things we talked about. And then we had to make decisions about when can you come back to work. And you see those things have changed over the past 18 months. And there's a lot of confusion, but it requires some thought. And the key is now. I'm going to talk about now because this has been evolving. Number one, get vaccinated, get your boosters. If you feel sick, if you have any symptoms, if you've been in a crowded social situation, use that test that the government sent you for free, or go to one of our testing sites and get tested. And notice I said testing sites, because sometimes if you walk into a freestanding emergency room or urgent care facility, you'll get hit with a bill over $100 for testing. So there are places like Hamilton, our 3 church sites through the city, and you can find them posted on the Genesee County Health Department website, and you can get tested. And I will tell you, people are not using those resources. So don't think you'll be waiting in a long line. Just 2 days ago, I went on the website, I made an appointment for 15 minutes later. I walked in and I was the only person there getting tested. And I got my result in 40 minutes. So you can get tested. And why would you get tested? Well, most of the outbreaks are occurring as a result of social situations. And so we have to look at the season. It's prom season. It's after party season. There are open houses. It's Mother's Day coming. So if you, and even church service and graduations, all these things, and weddings, if they come up, test yourself before you go. Test yourself 2 or 3 days after you go. If the test is negative, check yourself again in 48 hours. Okay, these are our most important things. And consider if you're in a work situation where you're always exposed to people, think about what we call cadence testing. And that is like the drum beat. Every week, test yourself, whether you feel sick or not, or every 2 weeks. But take advantage of that opportunity so you can prevent outbreaks among your families, friends, enemies, and coworkers.
So now, Dr. Reynolds, you understand why I call you the chief? Okay, I'm gonna leave that alone. You're leading this charge as a health advisor, and so you've said so many things. I think it's important. We wanted to give some attention to this today because we didn't give a lot of attention to what happens on the backside of these decision makers when people are coming out and saying these are the things you need to do. When you walk in and you see these barriers or you see these steps, why was that so important? So I want to shift over to the hospital side of it for a few minutes. I want to ask I see you, Tynesha. She's already Nurse T from Hurley Medical Center, because Hurley, too, one of our major hospitals, waiting to get patients, or didn't wait to get patients lined up. What was happening behind the scenes at Hurley?
Oh my God. At the time, I was the nurse manager of a real busy med surg unit. I still remember the day on a Saturday that I got called in to transition my unit into a COVID unit because the ED was backed up with positive COVID patients. We stayed front line. We had fears, going in, you gather your staff and, to see their face, to know and to hear that we're about to transition our unit to a COVID unit. We did non-traditional things. We created huddles to where the whole organization, at one point we was able to meet visibly, but we created Google huddles so that we could all communicate and share what was going on as far as our COVID patients, what was going on as far as our PPE. At the time it was a shortage, so we had to be smart in that, with our masks. It was a lot going on. Staff was getting sick. I mean, they were getting tested. We were losing staff, as some of the other ones were saying. Some were quitting. And then the agency started putting in, extra amounts of money for nurses to travel. So nurses were leaving. But what we did is we stayed frontline. We pulled our resources together, all hands on deck. And basically I prayed through the whole process. We were taking care of patients, not ever being in a pandemic before. And so a lot of people were saying, well, that's what they signed up for. Yes, we signed up to care for people, but this right here was something that we had never experienced before. So I thank God that we had a chief quality director like Dr. Yagi. He really led us through this pandemic. Our CEO, all hands on deck, the nursing staff, medical assistants. Like at one point with gowns, the shortage of gowns, people volunteered and we came in and we laundered gowns just so that we could have isolation gowns. I mean, it was a traumatic experience, but at the same time, it was a rewarding experience because we were able to pull together and care for our patients. We remained safe. Like even going to break, we had to, distance our breaks. People couldn't be in the same space without a mask. Working together when you was used to working hand in hand and being able to talk, but you had to like separate it from your family. Nurses and healthcare providers, we were staying in the same houses because we didn't want to take it home to our kids. So it was a traumatic experience, but at the same time, we made it through because of our leaders and everybody being, the heart to care for patients, the clinical excellence and the service to people. So,
Thank you, Nurse T. So we know even though it's challenging getting into appointments, sometimes they're canceled, but I think that communication and understanding what's going on behind the scene, the loss of staff, is really important. So as a resident, as a community member, we still want the best service, but maybe we could be a little bit more understanding and ask different kinds of questions. I want to just shift over here real quick to Dr. Wolford from University of Michigan. Some of our patients from Flint ended up getting, in Genesee County, ended up in your place. And so what were some of the considerations for the University Hospital? And particularly you as a PED working with them little babies.
Thank you so much, Yvonne. Yes, so as in pediatrics, we had, at least at the beginning, a little bit of a different experience from others because fewer children were getting severely ill. So that allowed us really to be more of a support to other parts of the hospital. So they took the parts that were usually dedicated to children and used them for adults. And some of the staff actually, who worked with pediatrics generally, were moved over to work with adults. And then the rest of us backfilled. So whereas I'm very in clinic just a small amount, I was moved into the hospital to spend more time to backfill for those people who went to help the adults. I was really struck by what Nurse T said about people saying that, well, people signed up for this, so, just do it, which is really interesting because I think, like, if a taxi driver signs up to be a taxi driver, it doesn't mean that I should just run a traffic light and, crash into them and kill them. Yeah, they signed up to be a taxi driver. It's a risk to be in an accident. That doesn't make any sense, right? Yes, so people signed up to do this, and we really want to help, and we really want to make a difference in the lives of our patients. But it's a group effort. It's something we have to do together. And so it really means a lot when people take precautions and wear masks and do testing and do all those things so that we can all keep each other safe. Because if medical staff are dying or medical staff are sick, then they can't provide the care that people need. So I just think we're all in it together.
Thank you, Dr. Susan. Thank you, Nurse T, Clarence, Jim, and Dr. Reynolds. Thank you all for that insight on background. We talked about employment and COVID. This affects us on both sides of that equation, whether you're an employee or an employer. The message is we've got to work together. So some of the things that Dr. Reynolds talked about that we did before, we still need to continue to do. And we will come back next week. I just want to put a pin in this for those of you that are listening. Please join us next week. We have a very special presenter that's going to talk as an infectious disease preventionist that's going to give us some really, really important information. So please join us next week to hear during our roundtable insights from the Dr. Shanina Knighton, who's going to come and be with us. So I want us to just take a minute for those of you that are in the world of public health out here. Kaylee is with the health department. The health department is designed to assure our public health. And so I'm going to ask Kaylee to come back and talk to us when we talk about the health department segment this today. Kaylee, I'll ask you to join us in that segment because we're going to shift right now. But thank you all for joining us in the roundtable. And I hope this was beneficial for those of you that have to think about whether it's an employer or you're an employer or an employee. We're in this together, and we've got to make sure that we're taking consideration of all these things that we've heard today. Today, we want to hear from Genesee Health Systems. This week is actually Children's Health Awareness, Mental Health Awareness Week. This month is Mental Health Awareness Month. So the whole month of May, there'll be a focus on mental health awareness. However, this week, May 1 through 7, is Children's Mental Health Week. And so with us today is Elizabeth Birch from the Genesee Health System. She's a director of children's services. She's going to give us a few minutes of some of the important elements that'll be happening during the month and what we should be thinking about as it relates to children's mental health. Elizabeth.
Thank you, Yvonne. Thank you so much for everybody. And I just want to say a special shout out to all the healthcare folks who are on this call and not on this call. There's so much that you guys did during the pandemic and continue to do. And I know that I personally am really grateful, and I know many are, and I know it doesn't always get noticed amongst all the negativity. So thank you so much for all you guys have done. Yeah, I just wanted to take a few minutes to talk a little bit about children's mental health. And as Yvonne says at the beginning of this webinar, kind of focusing it in our community. So one of the most exciting things that I want to just share and give an update on is the new GHS Center for Children's Integrated Services, which will is a beautiful new building downtown Flint on Saginaw Street by right at I-69 right there. You can drive by it. The outside of it is pretty much built. There will be an outdoor playground. And more importantly, the 3 children's buildings that we currently have will all be under one roof. So it will be so much easier and more efficient and better care for the families that we serve currently, and the families we'll continue to serve, especially as we think about our millage money and all of that. So I just want to talk a little bit about just children's mental health in general, but I want to give it a local spin here. You know, we've got the pandemic. We've 5-6 years have been exhausting. they've been traumatizing for us as adults and us as parents and employees and all of these other roles that we fill. And we have our kids that we got to think about too. So it's a lot to think about. And also it's not as difficult as you might think to support your kids or support the children in your life in terms of their mental health and well-being. I'm really thankful for a lot of the progressive things I see on social media and things of that about mental health and what that looks like and how we can support that. I like to just tell people, think about what you need when you're really upset. So obviously, most of us maybe don't have a tantrum if we can't do something that we really want to do. But what do you need when you're really, really, really upset? Do you need somebody like yelling at you? I don't know about you, but that typically makes me more upset. So I just want to say, when we talk about kids' mental health and supporting that, it's really about your relationship with them. And relationships are all about trust, and trust goes both ways. And so just validating your kids, they're allowed to have hard feelings. We want people to express their feelings. We know that it's not good. It's not good for any of us to bottle things up. So just letting your kids know that it's okay to cry. It's okay to have these feelings. I'm right here with you. These types of there's simple things to do that help your kids to realize that they're not alone, that feelings are very normal, and also feelings come and go, right? I mean, it's like nothing stays the same forever in terms of what our experience is. So I just want to encourage people to have those conversations with their kids, like, what was the best part of your day and what was the worst part of your day? And why was it that way? And just even asking that question as opposed to just how was school, right? Those are the kinds of things we can do to encourage our kids to talk about things that happened during the day and what their personal experience of it was, and open the door to hearing about what their experience is, because they do have their own experiences outside of what we think might be happening. So just encouraging them to talk so that if and when things get hard, when they become a teenager, when they become an adult, they know that it's okay and safe to talk about those hard things, because when they become an adult and they're struggling with depression or anxiety or substance abuse, we want them to be able to pick up the phone and call a family member or a friend, or call a crisis line. And it starts with us as parents and caregivers, adults in children's lives, to be able to show them that it's safe and okay to talk about their feelings. So that's really what I want to say. I know it seems a little cliche, but it really takes one positive interaction in a kid's world to completely change the way that their brain is wired. And we are wired to stay connected to one another, right, for survival. So I just want to encourage all of us on here who are, really interested in promoting positivity and health in our community. And we can do that really simply by being present with a child during a conversation. And it doesn't have to be this big, huge talk or anything like that. We can do it in little everyday moments. So thank you, Yvonne, so much for having me.
Thank you, Catherine. I just want to ask you too, Elizabeth. I'm sorry, Elizabeth. While we're in this space, we talk about social distancing, but we also talk about being connected. So I know we don't have a lot of time for this conversation today, but as we're thinking about coming back in the next few weeks, will there be opportunities for you to share with us how parents can learn these tips? Because sometimes we need some training or some ideas about how to have these conversations. So will you have in your conversations going forward some of those ways that parents can get support so they can be better supports for their children?
Absolutely. I look forward to coming back later this month and talking more about that. And like Yvonne says, if there's other ideas on what people want to hear about in terms of how they can support as parents or adults in children's lives, I'm happy to talk more about that later this month. But that's a great point, and I'll make sure that I hit on that.
And can you give us a number, Katie? And Kate, I keep calling you Katie because I'm thinking Katie's here with me every week, Elizabeth, that we can call if somebody gets an idea, they want to just give you a call.
Yep, you can call my department at 810-257-3777. And also if you need mental health supports or if you need to talk to someone, you can call that number too, and somebody will get you to the right place. So that's 257-3777. Thank you.
Thank you so much, Katie. We'll look forward. See there? You got to come back, Catherine, Elizabeth, so I can say your name more often. Thank you, Elizabeth, for being with us today. And we'll look forward to hearing from you again later in the month. So as we move forward, we're always talking about data. So when we talk about the Flint Center for Health Equity Solutions as being a part of this, one of the things that the center has done is helped us to make sure we're looking at data in a way that points out where the equities or inequities are. And one of the things that we've been proud of through this process is that we've reduced some of those equity gaps. And so Rick Sadler, who is the I call him the data guy, Rick's going to give us the update on the data for the race data for today. Welcome, Rick.
Yeah, thank you. So you can see the result, the case rates by race on the left-hand side of the slide here. Overall, the rates are up considerably in the last week. So this is definitely something to keep an eye on. Remember that a couple other metrics that we also want to keep an eye on are, well, continued increases, but also increases in hospitalizations and other severe outcomes. One thing I wanted to touch on this week is in terms of, the reason that we're tracking these, the breakdowns by race and by municipality and week by week. Again, it's not, the last few weeks we've been much lower. I mentioned last week that the rates of that week were a 20th and a 40th of what we had seen at two of our other peaks. But guess what? Now we're twice as high as we were last week. And so being able to keep an eye on these week to week, this surveillance is about prevention. It's not about reaction. So we don't want to be reacting when we all of a sudden see that there's an outbreak. There's an increase going on right now. And so folks who are unvaccinated in particular are at risk, or really anyone in the general population, we should be a little bit more careful in the weeks to come because there is an outbreak brewing. And so we saw increases both at Genesee County and in Flint. And our positivity rate, again, climbed up to 14.3%. So it's getting pretty high.
So Rick, you talked a little bit about surveillance. So can you help us to, how do we get this data? And we talked about this over and over again, but I think it's important now that we see in the difference. Dr. Reynolds mentioned earlier that the testing sites are not being utilized as frequently as they once were. Help us to understand again why it's important for us to get this data, and in what ways does the data help us get to these numbers, get to this understanding?
Well, I mean, without these numbers, without this data, we just wouldn't know what rates are. If you look at a national database, let's say like the New York Times website, county level metrics week by week, that doesn't always match up with the data that we're getting directly to the health department because it is fresher and more up to date. The New York Times is relying on, I think, either state level reporting or much broader level reporting, so they can't zoom in, they can't identify the same disparities, particularly at the municipality level or within a race group that we can, because we're getting the individual data. So yeah, it just allows us to do a lot more.
So that's another really important point about how important each one of us and I say our voice, your voice is being heard when you go and get tested. If you test positive, then that's a way for us to continue to see where these outbreaks are happening and how we can help inform our community. So when we talk about voice, it's not just these words we speak, but it's also the actions that we take. So thanks for sharing it with us, Rick, and keep us updated on what's happening in our community as it relates to the data.
Will do. Thanks.
Appreciate that. So our health department is here with us. I just want to ask our health department team. Today we have Kaylee, who is actually sitting in for the health officer, Dr. Hackert. We have Sherelle Brown, and we have Ashley. Now, I did not tell you what their roles and responsibilities are because I'm going to ask them, and we're going to go through each one of them, and they're going to tell us what they actually do at the health department and why their role is so important. And I want to start with you, Kaylee, because in our earlier conversation, we were talking about the employer employee situation. So can you talk to us a little bit about it from the public health world, the work that is happening in the health department? What were some of the considerations that you all had to think about? Because you're out to assure the health of the public, but you also have to make sure that your employees are safe as well. So, Kaylee.
Yeah, I think it was kind of difficult for us when the pandemic started because obviously we had to balance the safety of our staff with being able to respond to the pandemic. So overwhelmingly, our staff has been in the office even when the height of the pandemic was occurring. So the things that we've been talking about the whole time have been pivotally important to keeping the health of our staff up, which is again, utilization of masks in situations where it's appropriate, making sure that if you're ill, you're staying home so as not to expose others, really keeping those same things that we've been talking about throughout the entire pandemic and making sure that we were abiding by those guidelines, especially during the height of the pandemic, and then making sure that, we were having conversations when the vaccine came out about vaccination and if that was the right choice for you, and making sure that especially our staff that were working the vaccination clinics themselves had that vaccine, as they were, when we were over at Bishop, sometimes we had 2,500, 3,000 people coming in a day, and that's a lot of individuals to be exposed to. So making sure that our staff that were working those clinics were being exposed to the public, whether it was at testing sites or whether it was at vaccine clinics, making sure that they had tools at their disposal to minimize those exposures.
So Kelly, just tell us a little bit about what you do at the health department. What is your role at the health department? Many of our listeners may not be aware of that specifically.
Sure. So I'm the deputy health officer of the health department. I work directly under Dr. Hackert, who is our medical health officer. So my role is really to oversee day-to-day operations of the health department and make sure that our staff, such as Sherelle and Ashley, who both work in our emergency preparedness department, have what they need in order to successfully respond to things like pandemics. Both Ashley and Sherelle were pivotal in helping plan all of our vaccine clinics, from, how does traffic flow, to making sure that if it was a full day clinic, how are we going to feed our staff? Do we have schedules for breaks? Do we have chairs somewhere where if somebody's been standing for 4 or 5 hours, they can go have a break and sit down? So the logistics that go into all of these things, it's a lot. It's a lot for people to plan. But again, my main role is to make sure that our staff have what they need in order to be able to deliver these great services that we provide to the community, and make sure that, we have budgets are a big thing that we deal with, obviously, with COVID money coming in, and making sure that we had what we needed in order to supply the community with what they needed. And we have a lot of great community partners that aided us in that work, and making sure that our community partners have had what they needed, and making sure that we have things like contracts in place and agreements to, things like renting tents. I mean, there's a lot that goes into responding to these events that people just don't see, but are really the things that Ashley and Sherelle spend their entire week plus some on every week.
So we're gonna get some more details of what that looks like behind the scenes. So ladies, get ready. But let me ask you one other question. You talked about, doing that work and galvanizing partners, making sure that partners work together. So the health department was really responsible for getting these sites that are set up at the churches.
Yes.
And all that background work done.
Yeah, and we were very fortunate that we had such willing partners in the community to really commit to doing this for an unknown period of time. When this all first started, I think everybody was hopeful that, we heard the message 14 days to flatten the curve. And, as an epidemiologist, they always tell you that it has to be at least double the incubation period. So I think a lot of us were hopeful that that was the case, but a little bit skeptical that it would be that short. But these churches really stepped up to help us, not knowing how long it was going to be for, provided things like volunteers and space and assistance to make sure that the resources that we were given, whether it was from the state level or the federal level, to make sure that we could utilize those in a way that it would get to the community efficiently and quickly. So it's very important anytime you're dealing with something on a large scale to have partners like we're lucky to have here in Genesee County that are really willing to step up when they don't even know what's being asked.
Yeah. So I remember my first introduction to Sherelle was she's got a mask on out at a clinic. So Sherelle, Kaylee talked about some of the behind the scenes stuff, and we're going to pull up the slides for the activities that are happening in the next couple of weeks in the sites. But I do want to just take a quick minute. What was that experience like for you as an employee of the health department? Having to do what you do regularly, but then being thrust into some of those community experiences.
I would have to say that it was a lot of human interaction. I went from being in my office most days to being out in the community with thousands of faces coming through our clinics to inquire about the vaccine or receive the vaccine. It was kind of hard in the beginning because we had guidelines for who could get the vaccines because of the availability of the vaccine. So just educating the community and letting them know where they were in the phases was sometimes challenging. Everyone felt like they should be able to get the vaccine when the vaccine came out. But as we all know, it started with our seniors and then kind of trickled down by age groups. So it was quite the experience, very hands-on. Lots of education. People wanted to know why should they get the vaccine, which one was better, which one was more effective, and just being on site to educate and serve was very different than being in the office behind the scenes.
Yes, I want to put up for a minute. Let's look at the clinic sites. And as we're talking about what's happening at the clinic, I'm going to just challenge my team a little bit. If you put up those clinic sites so we can see just where those, Kaylee talked a little bit about the church sites. Those sites are still going on. There's been a little bit of adjustment in when those clinics are happening. So I want to put that up right quick if we could. And we'll just keep chatting. Sherelle, these sites, you talked a little bit about this is what's coming up this week, but they're not going on every week like they once were.
No, we have seen a decrease in the amount of community members coming out to receive their vaccination. We also have vaccinated 63% of the population in Genesee County, so we don't need to operate at full capacity as we once did before. So we have started to do that every other week at our main sites, Central Church of the Nazarene, Shiloh, Our Lady of Guadalupe. Those are our main sites that are always in place Tuesday, Wednesday, and Thursdays, and they're just every other week now instead of every week.
And then we have these special events that are coming up this week.
Yes.
Coming up this week. So First Trinity, it will be a new site for this coming week, along with Floyd McCree Theater. They're going to be having vaccine clinics. One as a matter of fact tomorrow. So what we want our community to know is, along with those traditional sites, we're going to have some additional sites that are going to be coming on. What they're called pop-up because they're not every week, but they're going to be available for our community as well. I think I want to go then to talk to you a little bit, Ashley, and tell us a little bit about, because you came on filling in for Sherelle and giving us all of these facts. So tell us a little bit about what you do at the health department in your role as it relates to this.
Absolutely. So I am the emergency preparedness coordinator here at the health department. The name kind of speaks for itself. I coordinate our emergency plans here on any given day, like today, where I'm able to be in the office and not out in the field. I am updating plans everywhere from crisis emergency communications to both public and internal, as well as mass vaccination plans, mass prophylaxis, mass fatality, you name it. So anything that sounds intense and extreme and chaotic, usually there's a plan behind it. It is an opportunity that I can't even explain how blessed I am to have it, to be able to see all of our plans come to fruition. Obviously, no one wants a pandemic, but it's nice to be able to execute your plans, in this case, mass vaccination, in order to continue on with quality improvement. You know, what can we do better? How can we serve our community better? How can we get this out there more efficiently? How can we get our education out there more efficiently? So being able to start this career during a pandemic has been both a blessing as well as a large learning experience. There's a lot of information and a lot of planning that goes into these mass clinics, a lot of coordination with community partners, sheriff's office in general. We did work very closely, and we still do work very closely with them. Everything down to the number of pens we need to have at each clinic, or the number of paper towels we should order, which sometimes we overestimate. So it's been a vast learning curve. We are definitely learning as we go. We are still learning as we go, you know, learning to dial back on the clinics. As the need decreases, we still want to promote that education. We still want to promote the message of keeping safe, how to go about your daily life in the safest way possible, where to get a vaccine, you know, if and when you have not received it, what's the best course of action for yourself. So really conveying that message on. But, you know.
So while you're right there, I want to just to talk a little bit about the stats for Genesee County, because this is what, for the three of you, this is what we talk about, specifically looking at what's going on here in Genesee County. And then we want to quickly go, because you talked about the number of people that are vaccinated. So if we could just get a quick update on this slide, and then we'll go to the total number of vaccinated.
Yeah, so I can take that. I mean, this is just the general data for all of the cases that we've had throughout the whole pandemic. So this gives you a good, 5,000 foot view of what's gone on throughout the entire pandemic. Obviously, we know that the age breakdowns and the race breakdowns have varied throughout the entirety of the pandemic. So to really get a good snapshot of what's going on now, you really want to be looking at that last 2 to 3 weeks of data rather than, the holistic data that's shown on this slide. But this slide does a good job of, really showing, at least in terms of the people that we know have been tested, what the magnitude of the COVID pandemic has looked like in this county. Because if you look at the total number of cases, that's 25% of our population that has had COVID. And we know that in the early part of the pandemic, testing availability was very minimal. So there were a lot of people who were told you probably had COVID, but were never tested. So at this point, to say that about 25% of our population was confirmed to have a COVID-19 infection is pretty significant.
So when we go to this next slide and we look at vaccination rates, because when we talk about Sherelle being out there with all those hundreds, thousands of people that it equated to over time, this is what it looks like now for our county and for our community, number of doses as well as the number of vaccines. So
so it's been a slow climb lately in terms of getting those first doses. Obviously, the state goal is 70%, and we're climbing closer and closer. We're getting a little bit closer every day. We know when it was the original strain of COVID we were dealing with and the first vaccine came out, we knew the efficacy of even just one vaccine was incredibly high. But as we've gone through more and more iterations of variants, we know that it's really important to not only be fully vaccinated, but also to be boosted. Ashley mentioned having a lot of plans, and part of emergency preparedness is you have to be able to scale up and you have to be able to scale down. And then you also have to be able to scale up after you've already scaled down. So looking at things like we have drug companies saying that an Omicron specific variant is going to be ready this fall. So even though we see those vaccine numbers and the need for boosters to decrease, we know that if a vaccine that covers the Omicron variant comes out, we know that that's going to require scaling up again. So that's something else that, looking at these first dose numbers tell us, what might we expect for the number of people who would want an Omicron specific vaccine in the fall. And that helps informs plans of how many clinics to have, how many staffing to have. You know, we have a nurse team with Michigan United who helps us a lot with the pop-up clinics. Do we have them doing separate events from ours, or do we put more staff at larger events to try and get more people through? So this data really helps us inform what we do in terms of emergency preparedness plans, whether we scale up, scale down, or scale down with the intent of knowing that we're going to have to scale up again, at least for a short time.
So the last thing we want to talk about in this segment is the fact that you're continuing to look at this to project the future, but then there is additional support available. So if we can just take a quick couple of seconds to just let our community know if they need information for something specific or someone specific, they can call you.
Absolutely. Our COVID call center is staffed Monday through Friday during working hours, so 9 to 5. And we do ask that the phone line is reserved for folks who either don't have computer access or are unable to use online resources. Thanks to, again, great community partners, we do have information available on our website in Spanish. If we do have any Spanish speakers who are unable to use the internet, if they're able to get to us through the COVID call center, we do have community partners we can reach out to have those conversations in Spanish so that people get the information that they need in a way and in a language that they feel comfortable with.
Thank you so much. Thank you, Kaylee, Ashley, and Sherelle. We appreciate you and want you to know we thank you for all the hard work you've done in our community. We're going to close our session out today talking to Kiana Towns-Williams, who's the Director of Communications of the City of Flint. Kiana, I
Hey,
know
good
you're
afternoon.
somewhere. Come forward.
Can you see me? Oh, I think I'm here now.
Now, Kiana, before you get started talking, I need you to take a couple minutes.
All right.
Because you just told me that you had a new title.
I do, as most folks know.
Tell us all about that.
All right. Can you hear me okay?
Yes, I can.
All right, very good. So as most folks know, I come on every other week as the manager of the Office of Public Health, but recently I received a promotion and became Director of Communications. So I'm really excited about the opportunity.
All right. So in your role at the city, you're going to be making sure we get all the greatest and latest updates every week.
That's the job. So first order of business is to be the spokesperson for the city of Flint and to get the information out via socials, being in contact with the media and making sure that our residents know what's happening in City Hall.
So are you the person we should come to when we want to know more?
Send me an email.
All right.
It depends on the information for sure. Generally, the first point of contact is the information desk for the community as they hold all of that information. And I sort of work on the larger conversations around the work that the city is doing.
Thank you. So what's up for today? We got a couple minutes. Give us the insights you mentioned before. You're going to tell us about Flint Recast.
All right, let's start here this afternoon at 1 o'clock. That's 2 minutes away. The 2022 mini grant convening is taking place right here at City Hall out on the back lawn. The public is invited to attend. And so at 1:30, the mayor is going to give out, we all have seen those large checks that are kind of fun as visuals. The mayor is going to deliver the grant checks to each of the grantees who are all listed here on the flyer, which is also available on the city's website. So we invite the public to come over to City Hall. Again, that portion of the convening starts at 1:30. And then tomorrow, for the community members who live around the mini station at Martin Luther King and Bishop, the city of Flint has partnered with the American Red Cross, and they're going to go out in the community and install smoke alarms. So all of the volunteers will start at the mini station and spread out into the community. They're going to door knock and ask residents if they'd like to install smoke detectors. So we wanted to make sure that the community was aware that the fire department and the American Red Cross will be out. And we look forward to supporting residents and getting those installed. And then finally, we still have the vaccination clinics and testing sites going on behalf of the city of Flint. So at the North End Mini Station on Wednesdays, 5 to 8 after work, you can catch us there. And then on Fridays from 11 to 2 at the mini station at Dort Highway.
Thank you so much, Kiana. Perfect timing, because our time is up for the day. We want to make sure that our community health workers and our social workers stay on a couple seconds after the webinar to make sure you get your information in for your contact hours and your community continuing education units. We want to thank you today for joining us for the Flint Community Webinar Coronavirus. We want to ask you to continue to like us on Facebook, subscribe to our YouTube channel, Healthy Flint. And of course, if you want more information, contact us at info@hfrcc.org or call us at 810-835-2130. We look forward to having you join us next week for session 113. We say happy Mother's Day to all the mothers. And again, let me say thank you for joining us, helping us get this information out to our community. And we'll look forward again to seeing you next week.